Good morning, madam. This is Akelo Frida, and I'm redoing the summary videos for maternal, infant, and child care. And I'll start by talking about briefly about the first topic, and that is nutrition before conception, implantation, and pregnancy. So, first of all, maternal nutrition. This one refers to the nutrient intake by a woman and utilization of those nutrients during pregnancy. Then it supports fertility, fetal growth, and maternal health. Then it helps prevent complications such as low birth weights and birth defects. The key nutrients required in this type of nutrition, they include iron, which increases blood volumes, therefore an oxygen transport, thereby preventing anemia. I also have folate, which prevents neural tube defects, and then zinc for DNA synthesis. So preconception nutrition, this one builds nutrient. This helps to build nutrient stores before pregnancy, and improves fertility and hormonal balance in the body. Then the nutrients that are required there are like folic acid, which prevents neural birth defects, as I talked in the first. Then other micronutrients like iron, folate, zinc, and vitamin D are also essential in this type of nutrition. And then we have the implantation nutrition, and this is critical in early stages of pregnancy, where adequate energy, proteins, and micronutrients are required. So this stage it supports embryonic attachment and development. And the last one, which is pregnancy nutrition. Here, nutritional requirements of the body increase progressively. That is from the first trimester to the second trimester to the third trimester, with the progressive increase in the second and third trimester. So let me talk about second topic, and that is care of pregnancy. This involves nutrition, exercise, and antenatal care. Pregnancy nutrition helps to prevent complications like anemia and the hypertension. So regular checkups to monitor the mother and infant health is very vital at this stage. So the next topic is stages of fetal development, and it mostly involves three stages. That is the germinal stage, the embryonic stage, and the fetal stage. So to begin with, the germinal stage involves fertilization, zygote formation, and implantation. Then the embryonic stage, this one is critical for organ formation, organs like the brain, the spinal cord. Then we have the fetal stage, and this stage focuses on the growth and maturation of those organs like the eyes, the lungs. Then the stages of fetal development, they are influenced by nutrition, that is like good feeding, the health of the mother, and then the environmental factors. When I talk about environmental factors, this talks about maybe the teratogens like smoke, drugs that will cause complications during pregnancy and birth outcomes. So on my fourth topic, and this is stages of labor and delivery. So to begin with, I would like to define what labor is, and this is a physiological process leading to birth. Then childbirth is the event of giving birth. Then delivery is the specific. Okay, delivery specifically now refers to the expulsion of the baby and the placenta from the uterus. So there are signs of labor to know that labor has started. We have regular uterine contractions. We have progressive cervical dilation. Then show is just like a blood stained mucus. Then we have rupture of membranes. That's people always sometimes refer us to water breaking. That's why people always refer to water breaking. Then in my next topic, and that is stages of labor. And in the stages of labor, we have basically 4 stages. And the first stage is cervical dilation, which begins with the onset of true labor. Then it begins with the onset of true labor, and contractions continue until full dilation is reached, which is 10 centimeters. Stage 2 of labor, we have delivery of the baby, and this one sometimes is called the pushing stage, where the actual giving birth takes place. And here the mother's effort is required, and then a skilled mother's efforts like pushing down and also controlled breathing. Then skilled birth attendance is important to detect earlier complications in delivery. Then our stage 3 is placental delivery, and this one it begins it starts with it immediately occurs after the other second stage, that is delivery of the baby, and it ends with the delivery of the placenta. So there are some characteristics of placental expulsion, and one is lengthening of the umbilical cord. The other one is a sudden gush of blood. Okay, I think that one is okay to explain that. Then I have the next one is the final stage is the recovery and monitoring of the mother. So this stage, it is vital for monitoring the recovery of the mother, and in monitoring vital signs like temperature, the impulse, and it's very important in detecting early complications like excessive bleeding. We have also now then I think I will go to my fifth topic, which is nutrition care and health of the newborn. So to begin with, a newborn is an infant in its first 28 days of life. Then we have characteristics of a healthy newborn. It should have normal birth weight of about 2.5 to 4 kilograms, and then a normal length, that is 45 centimeters to 55 centimeters. Then you should have regular breathing and heart rate. It should have good muscle tone. That includes things like suckling and so breastfeeding is the best source of nutrition during this stage of age of an infant. So and the baby is fed within the first 1 hour after birth. There's some importance of breast milk. That's one is it is easy to digest. Then it contains all the essential nutrients that are required by the infant. Then the something to note is that the infant should be fed 8 to 12 times daily, considering their hunger cues other than your timetable or something. Then also breastfeeding is colostrum in that breast milk, which is that yellowish milk, the first milk, is very important as it builds on the immune system of the newborn. So the newborn care, we have to keep the baby warm and cleaned. We have to practice proper eye, cord, and skin care. Then early immunization is very essential to monitor danger signs and poor feeding. Then in the next topic, which is physical, cognitive, and mental development of the child, it involves the physical, the cognitive, and emotional growth. It occurs in stages of infancy and middle childhood. Then it is influenced by nutrition, environment, and health. Then it requires monitoring and support. Developmental milestones are indicators of normal child development. They help track child growth and detect delays. These milestones include the motor, the language, and social skills. Then early intervention improves on the outcomes. So I would like to go to my 7th topic, and this is basic needs of a baby. So the baby has basic needs like feeding, sleep, hygiene, and warmth. So in the feeding part, exclusive breastfeeding for 6 months is essential. Exclusive breastfeeding is very essential due to the reasons I talked earlier, that breast milk, it contains all the essential nutrients that the baby needs, and it is easily digestible. Then on the aspect of bathing, make sure that the baby is always clean and it is bathed in lukewarm water, not too cold and not too hot or warm. Then the baby should also, the balanced diet helps support maternal and fetal health, so that should be taken note of. Then under rest, adequate rest prevents complications. Then safe exercises improves on circulation and reduces stress in the baby. So in this stage, responsive caregiving is essential as healthy lifestyle ensures better pregnancy outcomes. So I'll move on to my next topic, and that is feeding of the baby. This takes things like breastfeeding, artificial feeding, complementary feeding, dietary diversity, and weaning. So to begin with, infant feeding involves providing nourishment to the babies from birth through the first 2 years using breast milk, formula, and complementary foods to meet their nutritional needs. So to start with, the exclusive breastfeeding, which starts from 0 to 6 months of age. This one involves feeding the baby entirely on only milk, avoiding other solids or liquids like milk from other sources or what. Then After, we go to complementary feeding, and this involves introduction of solid and semi-solid foods gradually to the baby while breastfeeding continues and initially starts from 6 to 24 months. Then continued breastfeeding takes place up to at least 2 years of age or even beyond. And we have dietary diversity. And dietary diversity means feeding infants foods from multiple food groups to provide a wide variety of nutrients essential for growth. Then artificial feeding involves feeding an infant with infant formula and other types of milk instead of breast milk just. Then the weaning process. This is the process of gradually introducing an infant to family foods while reducing milk intake. So we have some importance of infant feeding, and one being that it supports physical and brain development. Then it strengthens the immunity and reduces infant morbidity and mortality, where morbidity is just like that is access to diseases. Then mortality is like the death rate, like just like death rate. So it prevents on the death and is the getting of disease in infants. That is in simple terms. The next topic is immunization and common childhood diseases and ailments. So I will start by defining what immunization is. An immunization is the process of protecting children from infectious diseases by stimulating their immune system to develop resistance against specific infections through vaccines. So their immunization has some importance, and this include one being protects children from serious diseases like polio, tuberculosis. Then reduces children morbidity and mortality, as I explained earlier on what mortality and morbidity mean. Then it promotes community immunity. So to move ahead, we have the types of immunization, where we have the active immunization, the passive and the routine immunization, then the supplemental immunization. Then the vaccines that are given at birth and infancy, they include BCG, BCG and polio birth vaccines. Then my next topic, I have good parenting, and this is the habit training. Okay, so the next topic is good parenting, habit training, role of play in growth and development. Then so to define parenting parenting in simple terms is the guiding, nurturing and supporting a child's physical, emotional and social growth from infancy through childhood. Then characteristics of good parenting: it involves balanced care, discipline and support. Then it is a continuous process. So good parenting is marked by love, affection, consistency, fairness and responsiveness for child's physical and emotional needs. So parenting has some different styles that include authoritative parenting, permissive parenting, neglectful parenting. Then you have authoritarian parenting. This takes me to the next topic, and that is the 11th topic, and it is all about family planning methods. So family planning, it involves making informed decisions to control the number and timing of children through various methods. Then what the goals of family planning? It involves spacing and limiting birth, then prevention of unintended pregnancies. That people always say that preventing of unwanted pregnancies. And uh, it involves improvement of maternal and child health. Then benefits of family planning. There is reduces maternal and child mortality. Then it improves on the family well-being, because if a family is able to plan their children in such a way, in a very good way, it is very easy for them to provide them economically and also give love in a very nice way. Give love to their children. Then it is important in the empowerment of individuals and couples. So here I have classifications of family planning methods, and first we have the natural methods, which also there is the calendar method, a thing of free and safe days. That is the method I'm talking about. Then abstinence from sex. We have the permanent methods, which include the female and male sterilization. We have the artificial methods that include the barrier by use of female and male condoms. We have the hormonal use of oral contraceptives, and then we have the use of IUDs, an IUD in full is intrauterine devices. So in my next topic, and that is safety in a home and common childhood accidents. So to begin with, the places where accidents occur, we have the kitchen, the bathroom, the bedroom, then outdoor home environment. So the accidents that are usually common, we have falls. We have falls maybe due to highly polished floors, or due to anxiety. Another one, we have burns and scalds, and then a burn, it's like a dry injury. Then maybe you get in close contact with maybe fire. And then we have scalds, and this one is like a moist injury. Another one you get maybe from steam. The other type of accident you have is poisoning. Another one you have drowning, maybe in water bodies, in swimming pools, or in the bathrooms. We have electric shock due to naked electric wires. I also have choking and suffocation. So choking may be due to as a result of taking inappropriate amounts of food, and then suffocation is due to it is common seeing young children wearing those polythene bags around their heads, and this may prevent them from breathing so properly, thereby leading to suffocation. So we have accident prevention and basic first aid as our last topic. So important of accident prevention: it reduces injuries and deaths, then protects children and vulnerable groups, then gives medical costs. It saves medical costs and time. So there are some common causes of accidents. Some causes of accidents at home will be like carelessness and lack of supervision. And then we have highly polished floors. This one will cause mostly falls. Then we have anxiety. There is and lack of safety knowledge. That's why sometimes we get people putting just paraffin and they put in maybe a bottle of Mirinda. Then when a child comes, it takes thinking it is Mirinda, therefore causing poisoning. So accident prevention. So accident prevention at home. We have to ensure proper storage of hazardous items and label them so that someone can easily know. Then safe and kitchen bathroom practices, whereby we have to keep our bathrooms dry to prevent people from falling, and our kitchen should not be highly polished. Then child proofing at home, whereby you have to put stair gates to protect them from falling. Then also we have to put adequate light so that any suspicion, to prevent, so that we can see any, we have to ensure proper lighting to ensure that all hazards are clearly seen. Thank you, madam. This is all I had for this course unit.